Hello, it's Pema Chopal-Malou, and I'm going to talk today about how you can make decisions about vaccinating your dogs and cats, and see if I can help you with that decision-making process. I'm going to go over the Western medical ideas and the holistic medical ideas for vaccinating your animals. In the Western medical ideas, we'll first go over what the AVMA has to say, which is the National Veterinary Medical Association. They say that the core vaccine should only be given every 3 to 5 years. They no longer recommend to be given every year. They also say to consider the lifestyle of the animal when deciding on what core vaccines to give. If your veterinarian is now giving the vaccines every year, then you should have a conversation with them about changing that for your animal. The American Association of Feline Practitioners also say to consider the lifestyle of the cat foremost in deciding what vaccines to give, and they do not advise to give all vaccines to all cats. This reduction in vaccinations has been advised since more adverse effects from vaccines have been on the rise, including vaccine-induced fibrosarcoma. The holistic medical ideas of vaccines include vaccines are not innocuous, they are inflammatory to the body, and Dr. Gene Dodds, who's a renowned veterinary hematologist, has also studied extensively the induction of hypothyroidism from vaccinations. We do advise that we should limit vaccines so that we limit the induction of vaccinosis-caused disease states. Do not give multiple vaccines at one time. Separate the vaccines in different visits at least 2 weeks apart. If your veterinarian is giving multiple vaccines, multivalent vaccines at one time, we don't recommend that, and either go to a holistic veterinarian so they can be separated out, or actually ask your veterinarian if you can separate them. At least separate the distemper shots from the rabies shots in separate visits. Dr. Gene Dodds and Dr. Ron Schultz, a veterinary immunology specialist, both say that after the dog and cat initial puppy and kitten vaccines and 1-year booster, they are immune for life and do not need repeated vaccines. With this in mind, in dogs, instead of vaccinating every 3 to 5 years for distemper parvo, except the rabies, we advise doing a blood antibody titer for distemper parvo. If their titers are high, then they do not need the vaccine, and if they're low, we would vaccinate. It states on the vaccine label to be given only to healthy animals, so if the animal has cancer or a chronic disease state, we do not advise vaccinating even for rabies. In these cases, we do titers, including for rabies, to prove protection. Vaccines for dogs. Bordetella is only to be given if they're going to be boarded and required by a puppy daycare center. Corona is not needed. It is a self-limiting disease, which means if the animal acquires the disease, they will get over it in a few days on their own. Lepto is only needed if they live near stagnant water, ponds, or streams where rats live, or near cow pastures. It is transmitted in urine-infected stagnant water. The Lyme vaccine is only 50 to 60% effective, so we do not advise this vaccine. Lyme disease is not a serious disease as it is in humans, and we would prefer to treat the Lyme disease state in dogs than to deal with serious autoimmune disease that the vaccine causes. Distemper adenovirus and parainfluenza, or a DAP shot, is given at 12 weeks of age. Do a titer at 5 months, then titer, distemper, or vaccinate for DAP as needed every 3 years. Parvo is given at 15 weeks of age, and then titer at 5 months, and then titer or vaccinate as needed every 3 years. Also, a good raw food or no-grain diet will boost their immune system and protect them from disease and allow them to not need any vaccines. Rabies vaccinate at 5 months of age, 1 year later, then every 3 years, and tighter if they're unhealthy. Use a thimerosal-free vaccine. Vaccines for cats. The feline leukemia virus vaccine is not advised because I have seen this cause lymphoma in cats. Indoor cats do not need vaccines except rabies is required by law or if the cat may bite someone. I don't know why this keeps coming up. Outdoor cats, the FVRCP is given at 12 and 15 weeks and 1 year later. Then titer for panleukopenia every 3 years are considered protected for life. Also, a good raw food, no-grain diet will boost their immune system and protect them from disease and allow them to not need vaccines. Rabies at 5 months, 1 year later, and every 3 years, and also use a thimerosal-free vaccine and titer if they're unhealthy. That's all I have to say about vaccines, and I hope this has helped you make decisions for your animals. Thank you.